Hello, my name is Benita Talamore. For the next few minutes, I'd like to grab your attention. I'd like to grab your attention in hopes to talk to you about a global disease, end-stage renal disease, and how we can combat end-stage renal disease with kidney transplants. So for the next few moments, come along with me as I lay out my strategy, developing health policy, using health literacy to help make a difference in our communities. I thought first I would utilize my company. My company is Loyalty Healthcare Services, and through the company, it's a small number of us who work together to reach our communities. Together, we actually work with partners, whether it's churches, schools, you name it. We come together to empower our clients using a collaborative approach. We come together to drive innovation and change by sharing valuable information, not just any information, but information that is valid and reliable. We believe that health literacy is an essential tool. It is the foundation to helping individuals such as you and myself to make well-informed decisions. Health literacy is important because health literacy is where someone such as myself can go into the community, share information, and I can share it in a way where it's comprehended easily, even by those who cannot read, so they can become well-informed, understanding their diseases, understand options in regards to treatment, understand consumer shopping regarding facilities and patient outcomes, all to help make a better choice. So our company, Loyalty Healthcare Services, actually is established on the United Nations SDGs, or otherwise Sustainable Development Goals. And there are a few that we look at. We look at good health and well-being. Why? Because we want to promote good, healthy communities. We embrace quality education. You can't have health literacy without education. You can't be in control of your health, mind, body, and soul without the tools to be successful. We embrace inclusive and decent employment. We want all of our communities to continue to grow from an economical perspective. And last but not least, number 10, we desire to reduce inequalities. That's inequalities in the community regarding discrimination, or even with healthcare. Our goal for this is to promote kidney transplants through health literacy. Meet the team. It's a small group of us, but together we're able to tap into the resources from Florida all the way up through Pennsylvania, as far out to the Midwest as Detroit, and right particularly through Central Virginia, the Carolinas is where we do the vast majority of our work. Now, end-stage renal disease, I think it's important that we understand that no nation is exempt. All around the globe, people will be diagnosed with end-stage renal disease. For the sake of this particular assignment, I'd like to choose to focus on the Black community. Why, might you ask? It's simple, because we know, most of us in healthcare understand, that there are two comorbidities that really promote a fast decline with one's kidneys, and that's diabetes and the silent killer, hypertension, right? So by focusing our efforts on the Black community, we're hopeful that we can do one or two things. We either can prevent end-stage renal disease because of the information shared, or we can help with promoting kidney transplants. If you take a look here at our market summary, where we see that kidney transplants are actually being performed all around the globe, we see that the maroon colors here are areas that there's a strong infrastructure in place where kidney transplants are done, very successful. We actually have certain, but maybe perhaps the top 5 countries. We see the United States is strong. We see Thailand, which is also strong, India, Europe. There are many countries that have a good infrastructure in place. For example, India is the second largest kidney transplant. The success there is 90 to 95%. The average cost of a kidney transplant is just $13,000 in India. In Turkey, it's the average cost of a kidney transplant is $21,000. Spain, believe it or not, Spain leads the world in organ procurement. So there are opportunities here. We see where we're reaching the globe by getting the information out. This particular graph here, there are 2 graphs, and what we happen to see is where an anesthesiologist over in India did some research, and he was interested on the types of renal replacement therapy and how it added quality to one's life, quality in the sense of enjoying life and additional years. So this first here, we see where this red, we see that years were added, right, for someone who received a kidney from a living donor. Compare this to this very steep decline. This steep decline represents individuals who are on dialysis. And then next to it, wow, look how we've now closed the gap. We've closed the gap because in both of these cases, patients have received kidney transplants. The only difference, some received them from living donors and the others from deceased donors. I thought it was most interesting and very eye-opening, right? As I was doing my research, I came across the European Transplant and Dialysis Games. What an awesome way to promote organ procurement. Here in the UK, there are going to be games, multi-sport orientation games, competitions, you name it. And to be able to compete, these are individuals who actually received solid organs, right? Over 25 countries actually come together for this. This is a wonderful, amazing way to promote organ procurement and organ transplants. Can you imagine if we were to do something like this, very competitive in the United States? What a great way to market transplants. Here in the United States, previously in the course, I had an opportunity to compare and contrast organ procurement in the United States with Mexico. What we saw, they lined up with, again, United Nations, the SDG3, early warning, risk reduction, and management of health risk. How do we achieve that? Through health literacy. In the United States, we understand that over 93,000 people, that's a huge number, are on the wait list. Now, that's just the wait list for all organs. There's a separate wait list with a wait time of approximately 5 years for kidneys, right? Of that particular wait list, those waiting for kidneys, the vast majority, 60 to 65%, are actually African Americans. Now, here's the other thing I discovered. During COVID, transplants increased, right? But you know who really benefited? A lot of people probably who were at the end of the line. Why, might you ask? Because while there was a lot of opportunity, healthy opportunity because of someone's loss during COVID, I should say, they were able to give a gift of life. Even though organs were coming our way, there was a lot of facilities who could not do the procedures, right? So each organ was accounted for or received, I should say. But again, COVID had an impact. We also see that in the United States, going back to structure, we have UNOS, the United Network for Organ Sharing. They hold us accountable. And through their research, they were able to close the gap between Caucasians, Asians, Blacks. And by closing the gap, they were able to decide and determine and conclude that the best response for a kidney transplant are those with a genetic factor of like ethnicity, right? Through health literacy, we were also able to help close the gap, meaning one's lifestyle, diet, and exercise. Now, you take a well structured program like what we have here in the United States and we go to compare it in Mexico. Well, first of all, we understand Mexico doesn't have a lot of the funding. Next, we understand there's a huge gap, primarily because of the lack of commitment from from the healthcare institutions. Why might you add? You have to be a specialized certified facility to be able to do the transplants, right? So what ends up happening, even if a kidney became available, if they weren't in the system or someone on the list wasn't in the region, right? That kidney would go to someone else. So what we end up with is a very low number of individuals who need kidney transplants in Mexico, but simply can't get them. Now, having said that, what we also know is the value of NGOs, non-governmental organizations. This is where I did find through my research where non-government organizations came into Mexico, donated money, significant funds to help with transplants. Why? Because NGOs, as we call them, can easily navigate through the political cobwebs is what I like to refer to them as. They can come in, do what they have to do, and come right back out, and nothing is tied up in court. So lots of opportunity there in Mexico, but I do see them as a developing country. I mentioned that there were two types of renal replacement therapy. Now, dialysis is big. Dialysis is not going anywhere. It's here. There are great benefits. I was listening to a survivor, and what she said to me was, hey, you know what? At the end of the day, I want to be alive. I want to see my kids and my grandkids grow. And so, with that being said, that individual was comfortable being on dialysis. She's accepted as her way of life. When the fluid is pulled, right, these patients are able to just exhale. Why? Because there's nothing making them feel like they're drowning, right? And the chest pain goes away. Now, the con of that is dialysis is typically 3 days a week, 4 hours a day. It's exhausting as all get out. These individuals typically struggle. They struggle with fatigue. So they're not able to work full-time jobs in many cases. These individuals have restricted diets, restricted fluids. And so with that being said, they also have to consider how going and receiving dialysis impacts their family activities. If they go on vacation, they have to go somewhere where they actually have facilities, right? So there's a lot of coordination. So again, dialysis is not going anywhere. It is there. But one thing we understand about dialysis is that it just cleans the blood, right? It does not replace hormones. So with that being said, there is work to do regarding organ procurement, work to do so that we can increase the number of kidney transplants, because at the end of the day, it's a supply and demand. And we know that the demand far exceeds the supply. This is where participatory rapid appraisal comes in, where we go out to the community to talk to people, to gain input so that we can get their buy-in. I'm going to bypass this slide, but what this slide is, and it actually does work, it's a slide where I actually took the time to interview someone, interview them in the sense of trying to get their input regarding my proposal on health policy. One of the things that we had to do, we had to decide, how are we really going to go about achieving this? For me, it was easy. It was using the resources in my hand. Congressman Bobby Scott, Robert Scott, otherwise known as Bobby Scott, is a representative and has been up on Capitol Hill for a number of years. He proudly represents the Hampton Roads area, particularly Newport News, Hampton and all. He proudly represents the veterans at the Hampton VA Medical Center. He proudly represents African Americans in the sense of his organizations that he's affiliated with, to include my fraternity brothers, the men of Alpha Phi Alpha Fraternity Incorporated. He is approachable and he likes to hear from his constituents. So, with that being said, I considered what was in my hands, but I also considered his work and the things that he's in alignment to make sure that what he supports, my company supports. Examples include up on the Hill. He actually helped with the Reopen and Rebuild America School Act of 2021, promoting education for all, healthy meals and healthy kids, promoting well-being. In the workforce, he promoted the workforce initiatives such as relaunching America's Workforce Act, to also include the Transformation to Competitive Integrated Employment Act. So yes, for me, it was no competition whatsoever. This was the route that I would use so that I can tap into my resources, so that we can empower individuals within the Black community and help them to make well-informed decisions. My plan laid out before you. Again, the goal is to promote kidney transplants through health literacy. By May of 2024, I'd like my company to be able to demonstrate increased list of organ donors in Virginia. How are we going to use that? By helping them, hands-on helping them with free online registration through health literacy. That's helping them if they choose, not if we force, because that's not what we're into. The second objective is facilitate 10 health forums around the community, right? Within 100 miles radius of our company. We want to get out. We want to empower people. We want people to be well informed to make good decisions. And last, to facilitate at least 5 presentations on end-stage renal disease, to utilize social media as a platform so that we can move forward. So here we have draft the health policy proposal in September to get feedback that you too can provide. We'd like to run some focus groups. Our focus groups will be run in November and in December. And then we want to have a solid commitment by Congress Bobby Scott and his peers. For our plan, we're pushing for funding to help increase health literacy with a specific target. And those targets are end-stage renal disease and kidney transplants. We want to make sure that we're securing collaboration. Collaboration, ladies and gentlemen, help us to keep costs down. Collaboration helps to ensure that this valuable information is going to reach the masses. Collaboration with organizations is something that we can tap into. Why? Because most often our organizations have similar interest. We want to continue to run focus groups. And this is where getting into the community ahead of time to gain buy-in matters. In May of next year, we want to have a gala. We want to have a gala, that is. We want to dress up and for a night on the town. We want to be able to do this so that we can raise funds for health literacy. One thing that we also want to make sure that we're doing, the vast majority of our information will be disseminated through technology. We're not interested in developing and printing a lot of brochures that will get outdated, but with the use of technology, that way we can make certain that people, recipients such as yourself, are getting updated information. We want to successfully launch the health literacy program in July. By December, the end of the year, we plan to end strong. We plan to end by meeting with LifeNet to look at our numbers and evaluate our metrics, right? This is important. Earlier in the term, I had the opportunity to meet with and interview his name is drawing the blank right now. And it was important that I met with him. He had a clinical resource. It was a vice president at Life. I can't think of his name, and I'm so sorry, but he was the vice president. So again, really tapping into these organizations to help make a difference. When I think about a time to reflect, I think about the opportunity that says, hey, we are going to end strong. We're going to take what's in our hands. We're going to line it up with synergy. We're going to empower people through education. We're going to utilize the organizations within our communities, from the churches to organizations like the YMCA, the Boys and Girls Club of America. We are going to end strong. Health literacy is needed, and most of all, it is achievable. Thank you.